Hi everybody, my name is Mohammed Saad. I'm going to talk to you about the causes of stroke. Classify them into two groups. First group is including those causes that are more modifiable with more time for patients and providers to intervene and do something about slowing down or even preventing strokes. The second group would be of causes that are less modifiable and more abrupt in their course, and there's less time to intervene or treat. First group of causes, I start with the first and foremost cause, which is high blood pressure. Second cause would be high cholesterol. And the third cause would be smoking. It's estimated in research that smokers are at 2 to 4 folds increased risk of having a stroke than non-smokers. More causes include poorly controlled blood sugar or diabetes, and obesity, which is overweight, and sedentary lifestyle and bad dietary habits, all of which again could be simply reversed and completely controlled if patients do follow good instructions. Now, all of those causes collectively contributed to forming what's called atherosclerotic plaques. Those are usually plaques of fat that precipitate in the arteries that are feeding the brain. Those plaques can harden and either narrow down the pathway of blood or completely block blood from flowing to the brain. In any case, it will give you or give a patient either temporary or permanent damages to the brain, which is basically what a stroke is. More causes that could be reversed include cocaine use and patients with chronic heart conditions that propens them into having blood clots such as atrial fibrillation, which is an arrhythmia, or congestive heart failure. Now, moving on to causes that are more serious and again less modifiable, we are going to talk about causes that pertain to arterial malformation that usually is related to aging, and that's something that's called aneurysm or arteriovenous malformation. There are other causes including aging, which was found to be a separate risk factor for patients to have stroke. Other causes include some condition called amyloidosis, which basically is aging of the blood vessels feeding the brain. Other causes are blood clots, or when patients are on blood thinners, which propenses them to develop unwanted bleeding into their brains. There's also a less common cause that is called vasculitis, which is basically an autoimmune inflammation of the blood vessels feeding the brain, which could also cause a stroke. And of course, head trauma could be a reason for stroke or bleeding into the brain. By this, we would cover pretty much the main causes of stroke, and I would move on to my colleague Monica to talk about solutions for stroke.